My name's Chris Wark. I'm from Memphis, Tennessee, and I came all the way here to tell you my story. I was diagnosed with stage 3 colon cancer in 2003. I was 26 years old. There aren't a whole lot of 26-year-olds that get colon cancer. It's kind of an old person disease, but I had it. I had surgery about 2 weeks after the diagnosis. They took out a third of my colon. They took out a golf ball-sized tumor. When I was in the hospital, the day I was checking out, I asked the surgeon, is there any food I need to eat or avoid? Or he said, nah, just don't lift anything heavier than a beer. First meal they served me in the hospital after my surgery was a sloppy Joe. So what I did was I went home and ate sloppy Joes and didn't lift anything heavier than a beer, and here I am. No, I'm just kidding. So they told me I'd have to do 9 months of chemotherapy. I started researching chemotherapy when I realized that it would destroy my immune system and how ineffective it was. I decided I didn't want to do it. I had intense family pressure to meet with the oncologist anyway. And anyone in this room that's pursuing alternative therapy knows how intense the pressure is from family, friends, doctors to just follow the prescribed path. So I reluctantly agreed to go meet with an oncologist. My wife and I sat in his office. He told me I had a 60% chance of living 5 years, which is kind of true because that's what all cancer patients have, but it wasn't specifically true for someone with colon cancer. I asked him what other alternative therapies were available, and he said none. There are none. If you don't do chemotherapy, you're insane.
Cancer treatment in the United States, we have lost the war on cancer. We have lost the war on cancer. Why? Because cancer is not a reductionistic phenomenon. Cancer is a holistic phenomenon. And when you try to bring a reductionistic methodology like drugs and surgery to bear on a holistic phenomenon, you will completely miss the boat each and every time. You cannot do it.
It's not hard to realize that traditional treatments for chronic disease have a lot to be desired, leave a lot to be desired, right? If someone has a heart attack or you have a fracture, the U.S. is the best place to be. You know, go there, stay there, be there. But for chronic disease, yeah, it's not as good.
I wrote a book. It's called The MD Emperor Has No Clothes, right? In my book, I have a bulleted list of 10 questions that every cancer patient should ask their doctor. 10 questions. I've had patients kicked out, literally, kicked out of the oncologist's office because the doctor was PO'd that the patient was asking him these questions. And these are just common sense questions.
I asked him about the raw foods diet because I'd been reading up on it. He said, that'll fight the chemo. You can't do that. I knew I was onto something when he said that. I asked him, no, he also said to me, look, you know, I'm not telling you this because I need your business. Why would you say that? Like, that was the furthest thing from my mind. But then when he said it, I was like, oh wow, yeah, this is a business, isn't it?
The relationship between profits and cancer in the United States. There was a study that was published, I believe it was in 1994. It was a 12-year program. 12-year study. They looked at adults who had developed cancer as an adult, not childhood cancer, but adult cancer, right? And this is the main types of cancer that we get here in the United States. They did a meta-analysis of these people all around the world who developed cancer as adults for 12 years and were treated with chemo. And they looked at the results. And they published the results in the Journal of Clinical Oncology. And the results? 97% of the time, chemotherapy does not work.
And if we look with respect to chemotherapy and conventional cancer therapies, which was your question, from 1950 to 2005, in 55 years, this was studied in the US, where the rate of heart disease, the death of heart disease per 100,000 people decreased by 74%. The death rate for 100,000 people for stroke decreased by 64%. From flus and pneumonia decrease 40-something%. But in cancer, 5%. In 55 years, the death rate for 100,000 people with conventional therapy only decreased by 5%. So where are the advancements in chemo and radiation? Where are they, right? The research on cancer stem cells is finding the following. The majority, up to 99% of cells in a tumor are non-cancer stem cells. The minority population, 1% or less, are cancer stem cells. The same ones that are not affected by chemo and or radiation therapy. On the contrary, it makes cancer stem cells more resistant and more aggressive. So when a patient, they have their scans, PET scans, CT scans, MRI, and they locate the tumor or tumors, and then someone does chemo and or radiation. Then they do their 5-6 cycles, and then wait a little bit, and they go for their scan again. Wow, great results. We can't see the tumor, or it's decreased X percentage, 60%, 70%. So everything looks good. And that patient is monitored. Come back in 3 months for another scan. Come back in 6 months for another scan. Well, one thing is you're giving them more radiation all the time, making them even more toxic, right? And making more DNA and RNA potential mutations with the radiation. As a matter of fact, I'm skipping to something else, but in 2009, there was a publication in the LA Times and USA Today that there was 24,500 new cancers specifically attributed to radiation from CAT scans. And don't quote me on the exact number, but around 16,500 deaths attributed to radiation accumulation from CAT scans.
97% of the time it doesn't work. So why is it still used? It's one reason and one reason only: money. If you go to a medical doctor, an MD, with a sinus infection, and that doctor prescribes an antibiotic, he gets no financial kickback. Now, if he prescribes 5,000, of that antibiotic in 1 month, the drug company that makes it might send him to Cancun for a conference, right? But he gets no direct remuneration. It's not with chemotherapeutic drugs, it's different. Chemotherapeutic drugs are the only classification of drugs that the prescribing doctor gets a direct cut of. So if your doctor prescribes chemotherapy for you, here's how it goes, more or less. The doctor buys it from the pharmaceutical company for $5,000, sells it to the patient for $12,000, insurance pays $9,000, and the doctor pockets the $4,000 difference. And there ought to be a law. The only reason chemotherapy is used is because doctors make money from it, period. It doesn't work 97% of the time. If Ford Motor Company made an automobile that exploded 97% of the time, would they still be in business? No. This is the tip of the iceberg of the control that the pharmaceutical industry has on us.
Went home, went 100% raw vegan, drank 8 glasses of vegetable juice every day. That's 64 ounces a day. Did that for well over a year. Worked with a local naturopath in Memphis named John Smothers. I did every therapy I could find. There's no magic bullet. I took every herbal supplement I'd read about. I did vitamin C IVs. I got a rebounder. I ran. I went to the sauna. I'm a Christian. I prayed like crazy, meditated on the scripture, I mean, that was a big thing for me. And it's been 8 years. All my tests are clean.
The reason that people get cancer in the United States and the reason that we have completely lousy outcomes is because medical doctors are driving the research bus. When women get together and do a 5K run for breast cancer, all of that money, do you think any of that money goes to nutritional research? Do you think any of that money goes to homeopathic research or acupuncture or traditional Chinese medicine or naturopathic research? No. All of it goes to drugs and surgery, which do not work. Now, why aren't those women running for selenium? If every girl in this country took 200 micrograms of selenium, in one generation we'd eliminate breast cancer by 82%. That's a big number. Why aren't we doing that? Because medicine in the United States is a for-profit industry, and most people are completely unaware of this, and most people bow down to the altar of MD-directed high-tech medicine at their own demise.